I have the honor this morning of introducing a good friend that I've known for a long time, and so pleased to be here in Muncie to welcome to the podium the Honorable Dennis Tyler, Mayor of Muncie. Dennis, please come on up. And I think, Dennis, you have a message for us that we're going to have some assistance with. Is that right?
Yes, I do. Thank you, Brian, and welcome, everybody. And thank you so much for being here this morning. I normally do a proclamation for programs this important, but I am going to turn it over to the Delaware County Pride team to do the proclamation. But I do want to thank everybody for being here this morning. This Healthy Alliance program is so important, and the partners in this room. I don't know how in the world, when I looked at your agenda, you're going to be wrapping this up at 11 o'clock, and what we're talking about today, you could probably have a 2 or 3 day forum on it. They're that important. When you look at the tobacco use going on in the state of Indiana, ladies and gentlemen, and the devastating effect that has on all of us that are employers in the public sector and in the private sector, then when you look at obesity, and I spent a lot of time going through our schools today, and I see so much obesity in our juvenile population, and you look at what that's impacting them with juvenile diabetes. That impacts the state of Indiana in such an impactful way. And then why do we have the highest autism birth rate in the nation going on right here in our area? And all of these issues impact healthcare costs for employers, and we're trying to figure out ways that we can take care of our employees, provide them with a decent quality living, but also give them a quality, affordable healthcare plan at the same time, and try to figure that out. And when you listen to President Mearns talking about some of the things that they're doing for their employees, we have done the same thing, and ironically, we have found that it worked. 20 years ago, I don't think anybody would have ever thought that if you incentivize an employee to be healthy, it'll make sense. A lot of the thoughts at that time was, well, we take this away from them, we take that away from them, we take that away from them, and by golly, they'll be healthy. Well, what we found out, that just didn't work. And the cost just continued and continued to rise. What we have found in the city of Muncie with our employees, by incentivizing them with good health and wellness programs that they can participate in and their families can participate in, our maintenance drug costs have went down 70% over the last 3 years. And it's all because of those types of programs, and a lot of that you'll be talking about here today. But thank you so much for being here. Let's listen to the proclamation and the importance of why you're here today. And thank you again, Brian, for your friendship over the years.
Come on up and set this here for you, unless you have it memorized. But yeah, please go ahead.
Whereas making Muncie a healthier place to live in is critical, so all residents have the opportunity to reach their full potential, both professionally and personally. And whereas a healthy workforce increases productivity, reduces healthcare costs, and makes Muncie more attractive for businesses large and small. And whereas public, nonprofit, business, corporate, and faith leaders all have a role to play in creating a culture of health, by working with patients, families, caregivers, and healthcare providers, and whereas ensuring equitable access to quality healthcare, promoting primary care and disease prevention, addressing behavioral health, addressing health disparities, implementing evidence-based programs, and supporting innovation is essential to improving Muncie health. And whereas the adult smoking rate of 21% in Delaware County contributes to high rates of cancer, heart disease, obesity, diabetes, and other serious illnesses, and whereas Indiana ranks 49th of the 50 states in public health spending, and additional state investments in public health are essential to improving health outcomes, and whereas the Muncie Alliance for a Healthier Indiana Town Hall brings together health, business, and community leaders to address important public health issues such as tobacco use, obesity, infant mortality, the opioid epidemic, and behavioral health. Now, therefore, be it resolved that I, Dennis Tyler, Mayor of the great city of Muncie of Indiana, do hereby proclaim June 13th, 2018, as Muncie State of Our Health Day in the city of Muncie. By this action, let it be known that I, as mayor of this great city, invite all citizens throughout Muncie, Indiana, to duly note this occasion, in witness whereof I have hereunto set my hand and caused the seal of the city of Muncie, Indiana, to be affixed on this 13th day of June, 2018.
Nice job. Very nice job. Thank you. Great job, and thank you, Mayor Tyler. My name is Brian Tabor. I'm the president of the Indiana Hospital Association. I want to welcome you all here this morning. We have a video that we're going to show in just a moment that will kind of tee up to you for you today what the Alliance is and the origin of this entity that we are excited to be a part of and really has been the catalyst for the discussion that we're going to have here today and what I know will be a lot of success in the public policy area, in the health improvement area for years to come. But I think that origin is important. But before we turn to that video, I just want to share a couple of things. I've had the pleasure and the honor of attending some of these events around the state. We've got many more to go, 17 road shows, and it has just been incredible and so inspirational to see communities come together across the entire region. I know we're here in Muncie, and we're going to hear facts about Delaware County specifically, but I know, the mission of the Alliance, we really are trying to pull together groups across the state. We're really looking here today. Hopefully we'll talk a little bit more about even the East Central Indiana region generally. I know we have members, some of our members of the Hospital Association from across the state here. I know we have Henry Community Health. I see Ann Vermillion from Marion General. I know we have partners from across this entire region, and that's really what it's going to take to improve public health. You really have to work across the entire community, across the entire continuum of healthcare. So thank you all for being a part of what we're trying to really kick off here today. The Alliance, I've been thinking about this name as we've met in these various forums across the state, and many of you, if not most of you, perhaps even all of us here today, are really already allied in many respects. That's why you're here today. It's why you volunteered to give so much of your time to be here to talk about these issues. Many of you already partner regularly. Hank and Meridian Health Services partnering with IU Health and others throughout the entire region. You're used to that kind of work. But what I really want to challenge you today here is how you can all individually and as your organizations leverage those alliances to take the message that we will hear today outside of this room. I think in the area of public health, and those of us that really value health and work with it day in and day out, we can sometimes preach too much to each other. We understand that. But what we really need to hone today, so be thinking about this as you hear all of the presentations, how we sharpen that message and how we can take action outside of what has traditionally been kind of a silo in public health. I'm so pleased to see we have engagement today. We're going to have a panel. We're going to hear from individuals in the business community. That's where we really need to go, is take this message outside the traditional healthcare or public health space. So engaging with business leaders, helping them understand why Hoosiers Health is so important to the bottom line of their businesses. Mayor Tyler talked about the impact on municipalities. That's why we've got the Association of Cities and Towns now, AIM, involved with this initiative. The Chamber is on board. But locally, that's where we need to, as allies here, leverage those partnerships and get corporate leaders engaged in this fight to improve public health. It matters for economic development. We do a good job in Indiana of talking about improvements that have been made in the tax structure or investments in infrastructure. There's a lot of talk, and rightly so, about education, workforce literacy, workforce preparation. But we've kind of had some of these ugly statistics. We've sort of hidden them away in the closet because we didn't want to talk about them. But now is the time, and the effort here through the Alliance is to let's kind of lay these facts bare and talk about them and come up with a path for how we're really going to improve. And I think we can do that. We've actually been ranked much higher in the past, and we've seen our our numbers slip. We know that we can make improvements, but we need to do that leveraging partnerships in this alliance, again, outside of our traditional space. So I am so excited and inspired. I feel very confident based on the response that we've had to this effort throughout the state, and we'll be kind of working our way south all the way through the fall and building towards a public policy agenda in 2019 in the Indiana General Assembly and hopefully beyond. One other thing that I would just add before we turn to the video, and Jen, if you want to come up and get that queued up for us, is I would say that we have some champions here today. I know that individuals, our state senators and representatives, your state senators and representatives here today are champions and allies of public health and a healthier Indiana. They've demonstrated that in the past. I've worked with them. So what we need to do is help them. Certainly, you need to talk to these individuals, but what we really need to do, again, is kind of create the groundswell of public support out there within the business community so that they have that momentum behind them as they kind of go into the next session of the Indiana General Assembly. So again, think about today when you hear these facts, write down a couple of people. Write down a couple of people that you work with, that you know in the community that you think would come into the fold and be part of this alliance and part of this effort. And that is one of the action steps I'd like you to take. Absolutely reaching out to members of the General Assembly, the governor, about the need to improve health. But think about how we get some of those kind of non-traditional partners into this fight.